My name is Dr. Brian Knobs. Today I'd like to share with you the most effective treatment for carpal tunnel syndrome. Carpal tunnel syndrome is an entrapment of the median nerve in the carpal tunnel, producing inflammation, causing pain, numbness, tingling, and weakness of the muscles of the arm and wrist. What I found is the most common or most effective treatment for carpal tunnel is cold laser therapy, wrist decompression therapy, and chiropractic adjustment of the wrist. I'd like to describe this to you in a little bit more detail. First of all, cold laser. Cold laser therapy is exactly what it sounds like. It's a non-heat producing laser which promotes intracellular healing. The laser is placed on the area of the carpal tunnel, the wrist, and gently applied there, which promotes, once again, intracellular healing, increased blood flow, decreased inflammation. Now, what does that mean for you, the patient? Helps relieve the pain that you're having from the carpal tunnel, the numbness, tingling. Secondly, improves the associated muscle spasm and tenderness of the muscles of the carpal tunnel, the wrist flexors, wrist extensors. And thirdly, helps improve your mobility, your ability to move your wrist normally like you should be able to. Now, I'd like to go into the second form of treatment we talked about, which is wrist decompression therapy. Wrist decompression therapy is a modern form of traction. What happens with this, the patient is placed on a wrist decompression accessory. The wrist is placed in there, and the decompression is applied with gentle pressure to the wrist, which is opening up the carpal tunnel, helping relieve the pressure which is on that median nerve, which is inflamed and entrapped in the carpal tunnel. What does that mean for you, the patient? What that means is immediate relief and improvement from the pain associated with carpal tunnel, the numbness and tingling, and muscle weakness. Secondly, a decrease in the muscle spasm and tenderness of the muscles of the carpal tunnel. Thirdly, improved ability to move your wrist. So you can move your wrist more normally because the pain and spasm are being decreased. Thirdly, the chiropractic adjustment of the wrist. What the chiropractic adjustment of the wrist is that we gently move the bones of the wrist back in place. By doing this, helps two things: improves the joint integrity and joint mobility, relieving joint pressure in the wrist. Secondly, it decreases the pinching of the nerve, the median nerve being pinched in the carpal tunnel. Now, what does that mean for you, the patient? That means less pain, decreased pain, improved function. Secondly, decreased muscle spasm and tenderness that are associated with carpal tunnel syndrome. And thirdly, your ability to move your wrist. You're able to move your wrist more normally because you have less pain and spasm. So, in summary, this combination of cold laser therapy, wrist decompression therapy, and a chiropractic adjustment of the wrist, the most effective treatment for carpal tunnel syndrome. Used by themselves, they are somewhat effective. Used together, highly effective. And in fact, what I've had my patients tell me, by getting this combination of therapy, they've noticed improvement in their ability to sleep at night. They can get a good night's sleep for the first time from this therapy oftentimes. Secondly, their daily hygiene. Their ability to wash their hair, brush their teeth, shave, put on a shirt. They're able to do that better with this combination of therapy. And finally, their ability to work, especially if you have a job where you use your wrist, which most of us do. If you're using your arms and wrists frequently, if you're a secretary typing, doing computer work, their ability to work, my patients have been related to me, improved by this combination of therapy. So, if you have carpal tunnel syndrome, you're tired of it, and you want to get back to a normal way of life, decreasing your pain, call me now. 896-9355.